I'm Kieran Walshe. I'm Professor of Health Policy and Management here at Manchester Business School, and I lead the Healthcare Management Group. We're a group of about 25 academics working here at the Business School. There's been a healthcare management group at MBS and at the university since the mid-1950s, involved in teaching, in research and consultancy in healthcare organisations and healthcare management. The broad aims of the Healthcare Management Group are to improve health and healthcare in the UK and internationally through three things really, through our research, where we work on generating new knowledge and putting it to work, working for governments, for healthcare research funders and for international agencies. We do it through our teaching. We run teaching programs where managers and leaders from healthcare organisations come to learn, to generate knowledge and to experience new ideas. And we do it through our consultancy as well, working directly with organisations. We do a lot of research that's about problems which the healthcare system faces and where we're trying to help them solve them. So if I give you some examples, we're involved in research on the performance of healthcare organisations, trying to understand how systems for managing performance, for regulating and overseeing performance are used and what impact they have on organisations and clinical performance. We're doing currently research on health and social care devolution in Greater Manchester and the way that new ways of organising health and social care might change the working of healthcare and social care systems. We're involved in research on organisations themselves, on boards and on leadership. And we're involved in a range of evaluations of, for example, new models and new ways of working in healthcare. Yeah, teaching is a big part of our work. We do everything from undergraduate teaching, where we're involved in our BSc management, and where we run modules on health management and health policy, through to our master's programs. We work with the University of Birmingham and KPMG in a consortium which provides teaching programs through the NHS Leadership Academy, the Elizabeth Garrett Anderson and Nye Bevan programs. Between them, those programs have over 2,000 participants at the present moment. They're very large scale, important national programs. We run international teaching programs, so we teach in all sorts of countries across the globe, and we're involved in fact in setting up new teaching programs with MBS's global centres. And of course we run postgraduate research programs, so we have PhD students and MPhil students. We like to think that there's a kind of virtuous circle between our teaching, our research and our consultancy, and I think this really does work in practice. So our research helps to generate new knowledge. It makes us credible in the eyes of healthcare organisations, that we know about the things that we're researching. That carries over into our teaching. Our teaching and our consultancy bring us into contact with the real world of healthcare organisations, people who are working, spending their careers in these organisations as leaders. And I think we take the learning we get from working with those people as students back into our research. That's actually a really tough question to answer, because business schools are multidisciplinary places. So we have on our staff people who have backgrounds in medical sociology, in econometrics, in operational research, in leadership, who have clinical backgrounds in nursing and other disciplines. And I think one of the really nice things about a unit like ours working in a business school is that we can bring together both those people in our group and people who work across the rest of the business school, who may have work experience in the finance sector, in retail, in strategic investment, in construction. And when we do it well, we can bring those people together to provide programs that I think another institution would really struggle to offer.